Thank you, Dr. Vitul, for inviting the Innovative Physicians Forum to represent this MAPICON 25. So, this is my article on gut microbiota and cardiovascular diseases. We know that human gut has a lot of bacteria teamed inside our colon, so it actually makes our microbiological ecosystem, because myriads of roughly trillions of bacteria reside and they are producing their metabolites, and that becomes a whole microbiome that is causing some kind of impact, maybe metabolical and other impacts. So dominant bacteria in our gut is particularly bacteria more than virus and fungus, and among the bacteria it is the Firmicutes, Bacteroides, Actinomycobacteria and Protobacteria are the more important bacteria in this phyla, and they are doing some kind of functions which are mostly useful, like energy absorption, breakdown of complex carbohydrates. There was a talk on regarding ragi or so. So these basically undigested particles are broken down into a useful substances by certain bacteroids, and then nutrient metabolites and metabolic functions are also imparted by the bacteria that we'll see in the subsequent slides. Like normal function in our body by these bacteria are digestion, defense, maintaining the intestinal epithelial integrity, regulation of immunity, supporting central nervous system, as well as very important, that is the metabolic effect. So there are so many modifiable and non-modifiable risk factors, and despite all the control of the risk factors, still we have not been able to bring down the cardiovascular risks. So there is another factor, and after this reading and going through the role of microbiota, I think this also should be incorporated in one of the risk factors, the management of our gut microbiota. So on the left side we see that directly effect of the microbiota is on our body and is on the atherosclerosis, hypertension and vascular inflammation, and indirect impact through the lipid metabolism through acting on obesity, glucose homeostasis and platelet activity. It finally has its own role in management of cardiovascular events. So these are the few of the microbiome. Microbiome is the microbiota itself, as well as its derived products, which are combined known as microbiome. So microbiome derived compounds are like short chain fatty acids, lipopolysaccharides, choline related compounds, even secondary bile acids, etc. They have their role in participating into the metabolism and lot of cardiovascular effects. So just naming few, lipopolysaccharides is a substance which is released from the gram-negative bacteria, and it comes to the circulation and goes to the liver, where it causes a lot of inflammatory effects, and through its inflammatory effects it can cause a lot of metabolic activities, and even the inflammatory markers there also are important, even obesity, hypertension, diabetes and even cancer also. And other important substances are small chain fatty acids, TMAO. I will just narrating few one after another. So small chain fatty acids are very important. Actually, inside when we say that you take lot of fibers, so microbiota inside our body converts these indigestible polysaccharides into the useful substances, particularly butyrates, which prevents against the inflammation, and it maintains the intestinal integrity also. So this SCFA is very important, and it is working through the undigestible fermented fibers. Coprostanol and cardiovascular health. What happens that this microbiota not only have the effect on the inflammation part of the story, but the cholesterol inside our body is converted into coprostanol inside the gut, and lot of cholesterol is absorbed, and it is basically removed from our body system by these bacteria. So high SCFA fecal levels increases the increased cholesterol to coprostanol conversion, and that is linked to the lower serum cholesterol level. So this is one of the other mechanism by microbacteria. As I told, lipopolysaccharides are the substances released from the gram-negative bacteria, and they enter the circulation during the dysbiosis, and they cause lot of foam cell formation and further atherogenicity inside our body. TMAO is very important, and this particular reagent is being targeted and evaluated whether inside our body, besides the addressing cholesterol and other factors, can we address TMAO to reduce our cardiovascular events. So what is TMAO? On the left side we see that choline and carnitine, particularly in our diet, which come from red meat, eggs and sometimes milk, they go inside the gut, and in the gut lumen it is converted into the TMAO. So from it is when converted to TMAO through liver, so it has got so many of atherogenic effect that we can see it can impart in thrombosis, atherosclerosis, heart failure, kidney fibrosis, and so many other factors is produced by through this TMAO. So first, this is two-way conversion. First, the bacteria convert this choline into TMA, and from TMA it is converted to TMAO, which comes into the circulation, causes lot of atherogenic effect. There is also TMAO level, if it is more than 3, so this becomes very atherogenic, and there are certain medicines are being evolved to address, reduce the level of TMAO in our body. Bile acids, we know that it is something which is used in digestion, but besides this having effect on the gut, it has its effect on the cardiovascular disease also. Primary bile acids, it is synthesized in the liver, so it is secreted into the intestine thereafter. From intestine, the gut microbiota convert these primary bile acids to secondary bile acids, which goes back into the circulation, and plays its role. So when excess of the primary bile acid in case of dysbiosis also causes atherogenicity, as I will tell in the subsequent slides. So here, as we told, that primary bile acid comes into our intestinal circulation, and from here it goes to the liver to make the secondary bile acids. So in gut dysbiosis, what happens that the primary bile acid concentration increases, so it disrupts the primary to secondary BA conversion, also takes the second place. There the FXR and TGR receptor activity is disturbed, and on one hand it causes the increased lipid accumulation, inflammation, as well as on the other hand it can cause the cytokine productivity and inflammation and glucose hyperproductivity. There are clinical evidences are also seen in the biliary diseases, like in case of primary biliary cholangitis, prolonged QTc interval, abnormal LV ejection times is quite noticeable, and certain cholestatic disorders, like primary biliary cholangitis, etc., they are associated with the increased risk of cardiovascular disease, as well as doubling the prevalence of the lower extremity arterial disease. So there are quite references of this kind of effect is there. Other substance, the metabolite is phenylacetylglutamine, which causes increase in platelet activity and thrombosis, and in-stent thrombosis is also seen while there is increased formation of phenylacetylglutamine. So this happens in the gut dysbiosis, and if we keep our gut biosis intact, so we can defer these kind of cardiovascular events. So just coming through the path, these are the whole pathway where it is gut microbiota is having its impact. Few I just mentioned, like increased lipopolysaccharides, which causes direct inflammation of in the guts and improves and the cascades of the inflammation cascades inside the liver is activated, where it can cause on one hand cardiovascular diseases, insulin resistance, even the NAFLD, and which is known these days known as MASLD, is also somehow affected through this mechanism. Other mechanism is like TMAO, as I told, it causes atherosclerosis, thrombosis, cardiorenal fibrosis, and inflammation of the inside our body. And these are all things that just recapitulating again. Small cell fatty acids, they are very important part the positive gut microbiota. It is seen that patients who has low SCFA, they have increased blood pressure and the interference in the myocardial repair is also there, and inflammation modulation also there. So SCFE is very, very important substance from the gut microbiota, and it is produced in presence of the polysaccharides inside our fibers. Other, as I told, the bile acids also modulate the lipid metabolism, glucose metabolism, and all these events are present in presence of the dysbiosis of our gut microbiota. Dysbiosis means the normal gut microbiota which is disturbed. So this is microbiota, and inflammation has a cardiovascular disease activities, because through gut microbiota we have seen there's so many of inflammatory markers which I am not naming them, just short of time. So inflammation is a key driver of CVD, and gut dysbiosis increases systemic inflammation via multiple routes. Name of a few, if we can name few, there IPS, IL-6, foam cells, cytokines, etc. So the clinical implication is seen that in case of hypertension, there is some microbiota dysbiosis is there which contributes to elevated blood pressure and inflammation. And it is seen the patient of hypertension has less diversity, microbial diversity, increase in certain microbacterial strains which can be measured in the time to come. Smoking also alters gut barrier functions, so it causes the gut dysbiosis, which is unclear whether this is changing in the cardiovascular risk, but there definitely some dysbiosis takes place. When we see that certain bacteria, like as we mentioned, that bacteria inside our gut can also change the cholesterol to cholepostenol. So this also takes place in presence of mycobacteria. So it leads to improved lipid profile and potential reduction in cardiovascular death if there is a good gut microbiota are there. And similarly, certain metabolites, microbial metabolites also play their role. Coming to the lipid metabolism, as I mentioned, that gut microbes modulate the lipid cholesterols. Cholesterol levels are converted into the stenols, which are another steroids inside our colon. Similarly, the bacterial membranes also absorbs cholesterol in their own formations. Deconjugation of the bile, as I told you, that from primary bile acid to second biliary acid is important, and if it is not converted, there is a lot of atherogenesis. Similarly, production of small chain fatty acids also takes participation in the cholesterol formation, and microbiota target therapies may help manage dyslipidemia and reduce the cardiovascular risks. So to address this thing, there is new microbiota target therapies. We know that we have been using a lot of prebiotics or probiotics, but certain molecules to address, like there is DMB or other kind of medicines which reduce, as I mentioned earlier, the TMA and TMAO are highly athogenic, and it is seen that if we reduce this TMAO itself can increase the coronary events by 4 times than normal. Fecal microbiota transplant is another concept which is in cardiovascular disease. It is found that when it is was done in the mice, there was reduction in the cardiovascular events was noticed. So we come to the dietary effects and what kind of diets can confer to which kind of microbiota. So in the red highlighted things are bad diets, like high fat diets, that is changed to certain change in strain of the microbiota and is linked to type 2 diabetes, loss of beneficial microbes. Plant-based diets, which is rich in the fibers, it improves the lipid metabolism, increase the small chain fatty acids, reduce inflammation by changing certain bacteria inside the gut. Vegetarian diet similarly is useful, causes reduced reduction of LDL. Similarly, Mediterranean diet, it has maximum effect in reduction of the cardiovascular events and the MASLD. Reduce the pro-inflammatory cytokines. Mediterranean diet is basically rich in fruits, fish, and the type of it was rich in the extra virgin olive oil type of the omega-3 rich diets. So coming to the certain drugs, which drugs are useful and bad. Metformin, liraglutide are good for our gut because it's improved metabolic outcomes through the improvement in the beneficial modulation of the gut microbiota. Omeprazole or pantoprazole, besides this is the other than the clindamycin, this is the other medicine which is mentioned in the literature causing the Clostridium difficile infection. So if patients is not being corrected from their diarrhea and they having continues to have diarrhea, kindly consider omeprazole or other PPI agents. This could be the cause of the uncontrolled diarrhea. Empagliflozin, again in the green, it causes also improved cardiometabolic benefit and is seen in certain change in the gut microbiota and microbiome. Captopril was, we don't use these things. Similarly, antibiotics are, broad spectrum antibiotics cause lot of dysbiosis and may impair the cardiovascular drug reaction. So prebiotics are the substances, because we use a lot of prebiotics, probiotics and symbiotics. So prebiotics are basically non-digestible compounds which are selectively stimulate the beneficial bacteria like lactobacillus, bifidobacterium, etc. They promote the SCFA production and small chain fatty acids, particularly butyrate part of that fatty acid. It is anti-inflammatory. It maintains the gut barrier. From there, the bacteria do not just dislodge and their metabolites do not go to the circulation and there is lack of inflammation. Probiotics are the life microorganism which conferring the health benefits according to WHO. So effective strains which we have been using in our country are Bifidobacterium, Lactobacillus and other Aggarwal, Municipala and etc. VSL number 3, that is one of the very useful agent which is being used and has been studied in various references. That is, we have 12 strains, which most of the strains are Lactobacillus, Streptococcus, etc. This has also very useful effect in the reduction of the inflammation by the bacteria. So there are certain probiotic supplementations, particularly which bacteria, and their results has been noticed that the supplementation of certain microbiome is on the left side and their health outcomes on the right side, where blood pressure, brain injury and anti-inflammatory cardioprotective roles has been conferred by certain microbiomes. So to sum up the dietary and probiotic interventions, these are helpful and they improve the lipid metabolism, they improve the blood pressure and they have anti-inflammatory effect, and reduction of TMAO levels also has effects on the atherogenesis, so have positive advantage in the cardiovascular events. So phytochemicals are the substances which are found in the fruit. So there are certain fruits and their active products which have their change in the gut microbiota, like these are list of the fruits which are change in the gut microbiota. These are the references by this their changing of gut microbiota, which is can have lot of benefits beside having their diet management part. They have lot of benefits, and when the gut microbiota is managed, it's not only the obesity, it's not only the cardiovascular events, but even the cardiovascular the cancer events, because the Cancer Society that says one should eat at least 10 fruits. We cannot eat 10 number of fruits within a different ratio should be taken every day to avoid the cancer. So these are the big, maybe because of the gut microbiota, they may be having their own effect. So another list of the various fruits. So there are certain futures research is needed, because precision nutrition, if we are still in a very native stage, we don't know that which particularly microbiota we will be using, and the researches are on where the microbiome modulation will be the sometimes the story of the day, and just examining the stool examination will be giving more information about the cardiovascular events to come. So to sum up that, the gut microbial metabolites like particularly TMAO promotes atherosclerosis and thrombosis. Short chain fatty acids preserves the vascular and metabolic health. Bile acids modulates the cholesterol metabolism, and the mechanism and pathways I have already discussed. The therapeutic approach of these changing the gut microbiota could be that it influences the microbial composition and activity. Probiotics and prebiotics moderate the gut microbiomes, and Neel enzyme inhibitor, which targets the TMAO biosynthesis, is also being researched for the future use in our human cells. So with that, I just thank you.